Today we are going to talk about early signs of pregnancy which can be seen on transvaginal ultrasound or sonography. Let's start with the first one, the intradecidual sign. Intradecidual sign is an early sonographic marker of intrauterine pregnancy that can be characterized by the gestational sac located within the thickened decidua around it. How can we see it on ultrasound? We can see a small oval or round structure which is our gestational sac, and it is placed eccentrically either on the left side either on the right side, placed within the thickened decidua. It can be seen in between 4 to 4.5 weeks of gestation. Its diagnostic and clinical relevance is this, that it helps to confirm the intrauterine pregnancy way before any other markers which can be seen on the ultrasound, either the yolk sac presence or fetal pulp. Also, it is the early identification of pregnancy and exclusion of conditions like ectopic pregnancy or gestational trophoblastic diseases. Now second, we are going to talk about double decidual sign. It is a sonographic feature just like intradecidual sign which can be observed in early pregnancy, and it is indicative of an intrauterine gestation. How we can see it on ultrasound? We see two concentric echogenic rings. One is this one and one is this one. We see two concentric echogenic rings around the gestational sac separated by a hypoechoic space, this blackish region. What are the layers we can see? We see the Decidua capsularis and Decidua parietalis, which is separated by the uterine cavity gap. You can see this in between 4.5 to 5.5 weeks of gestation. Its clinical relevance is that it confirms intrauterine pregnancy and excludes any ectopic pregnancy, and it is also a marker of normal pregnancy development. And the significance in practice is that it helps to reassure the doctor about the viability of a pregnancy before the presence of an visible yolk sac or fetal poles. Third is Double Bleb Sign. It is an early sonographic feature of pregnancy that represents the visualization of yolk sac and amniotic sac within the gestational sac. How we can see it on transvaginal sonography? We see two adjacent rings within the gestational sac. What are these two adjacent cellular structures? Which is yolk sac and amniotic sac, connecting via connecting stalk and divided by developing embryonic disc in between. It is typically seen in between 5 to 7 weeks of gestation, and the diagnostic importance is that it confirms the viable intrauterine pregnancy. It means that embryo or fetus is developing normally. It also differentiates from true gestational sac to a pseudo-gestational sac in ectopic pregnancy. The relevance of this stage in pregnancy is that the presence of yolk sac indicates the normal development and the nutrition of the developing embryo, and the clinical